Dr. Barbosa, you're new to your role here at PAHO, but you've been within the organization for many, many years. Most recently leading COVID vaccination efforts and access across the region. Looking ahead to the future, what is your vision for PAHO?
I think that one of the most important failures that we had was the lack of equitable access to vaccines. We need to guarantee that the countries will come together to establish a global mechanism to ensure equitable access. But there is a second action that we need to implement in Latin America and the Caribbean, that is to strengthen our capacity to produce vaccines, medicines, ventilators, and the personal protective equipment. So following the recommendations approved by our member state, PAHO is supporting and leading one regional platform to strengthen the local capacity that we already have in Latin America and the Caribbean, and it will be crucial to respond to a future pandemic.
What would you say are the biggest challenges that still remain in achieving some of those goals?
The most important challenge is to achieve consensus, because we are talking about the complex issues, political, diplomatic, so it has been a very, very intensive period of discussions. We are trying to support all our member states, including the small island development states, to participate in this debate, because I do believe this is a unique opportunity. If we don't get a good consensus in 2024, unfortunately, we will need to wait for the new public health crisis, for the new pandemic. For the second, we need to work with the countries, strengthen their capacities, regulatory capacities, to strengthen the public and private initiatives that are already in place in the region in order to have a sustainable development of the local capacity.
And all of that being said, do you feel confident that all of that would help PAHO handle or address the next pandemic, whatever that is?
Many important steps have already been adopted. For instance, genomic surveillance in the region now, we have a network of 25 countries in Latin America and the Caribbean performing genomic surveillance. This was a huge effort and a very important achievement. But we need to do more. We need to strengthen laboratory capacity, integration with health services, including primary health care, that for many diseases is the first line of detection.
What are some of the biggest health concerns right now across the region?
The region has a very complex epidemiological scenario, because at the same time we have communicable diseases that still persist, like TB, HIV, the outbreaks in the region like dengue fever, Zika and chikungunya. At the same time, we have a very important burden of non-communicable diseases that now are responsible for 82% of the total deaths in the region, and 30% of them are preventable and premature. We have at the same time the impact of climate change in many countries, in vector-borne diseases, and also violence and accidents. In some sub-regions of the Americas, in Central America, for instance, the homicide rate is similar to the countries that are in internal wars. So it's, for this complex, very complex scenario, we need to build resilient health systems. We need to strengthen primary health care, because primary health care is closer to the communities, can provide the first response, can provide the access for the vulnerable populations.
When it comes to climate change, we have seen the hottest year on record so far, July and September, the hottest months. How much of it is actually preventable?
Yes, health sector needs to be much more active in calling the attention of the society about the negative impacts provided by climate change, like the destruction of health facilities during extreme events, like hurricanes. At the same time, we have the situation related to vector-borne diseases, that this year we had the largest number of dengue fever recorded in history in Latin America, 30.5 million cases. So this is another example. And we also have food insecurity. because in many countries in Central America, for instance, the drought is completely devastation, is producing a complete devastation on agricultural production.
Looking across at the future of healthcare, of access, of availability, are you optimistic that now that the world is starting to recover, as you mentioned, from the pandemic, are you hopeful that everyone is moving in the right direction?
You know that we always hope for the best, but we also need to be very realistic about the challenge that we have. The pandemic showed us that nobody was really prepared to face a pandemic with the characteristics of COVID-19. We learned a lot of lessons during the pandemic, but we still needed to call the attention of the economic sector, the financial institutions, that health needs to be part and in the center of the development agenda. That without health and without a resilient health system, no economy is protected when we have a pandemic like COVID-19. And we know that we will have a new one in the future. We don't know when, we don't know the severity, but we know that this will happen again because we had the SARS, MERS, flu H1N1 in the past, so probably we will have a new one in the near future, and you need to be much better prepared. So this is one thing that is very important. The second is that to translate the attention that the health sector got during the pandemic into concrete actions to strengthen the systems, to have more resilient health systems, and to remove barriers to guarantee that we are really implementing universal health in the region.
Dr. Barbosa, thank you so much for your time. We appreciate you joining us.
I thank you for inviting me to be here.